Hello and welcome to Jimmy Lewis's instructional training video. Buckle up, sit back, and enjoy the ride.
Hi, my name is Jimmy Lewis. I'm an EMT student here at Ventura College, and I'm here to show you the differences between these bag valve masks here and the different patients we'll be using them on. So this is an adult size here, this is for pediatrics, this is for infants. And I will be demonstrating on this pediatric. We're gonna say he's anywhere between 6 to 12 years old. Follow me. So what we have here is the bag valve mask, and at the other end, you can see there's a different size for each of these, not only in the size of the device, but also the pocket mask that is going to go ahead and make a seal around the patient's face. So this is what we're going to be using for our pediatric patient today. Seals around like so. You're going to be using a CE clamp. You're going to tilt the head back to make sure the airway is open and ventilate. You're going to be looking for chest rise there. So what this is, right here, is a container for oxygen. And how this works is we connect high flow O2 to it using one of these hoses and an oxygen tank set at 15 liters per minute. So this is going to connect here. And this, I'll show you on the adult side just so you have a better view of it. And that's what we connect it to there. This bag fills up with oxygen and we ventilate our patient. You don't need oxygen in order to ventilate, but in some cases you're going to need that.
In a lot of cases, you'll need that.
This here is an infant size. Obviously, the pocket face mask is a lot smaller in size, and so is the device itself.
So Exhibit A gives us a great view of that pop-off valve here on these infant bag valve masks. So the functionality of this device is to release air if there's too much pressure being built up in that baby's lung, and it will release that air pressure to prevent a pneumothorax.
I will now demonstrate the National Registry standard for using the bag valve mask. So as always, the first step is going to be BSI, scene safety. So we show up on scene, our patient is unresponsive. I'm going to immediately request for additional EMS assistance from my partner or whoever I have on standby, and simultaneously I'm going to be checking for a pulse and looking for breathing. Notice how my eyes are looking at the chest. I'm looking for rise and fall. I don't see anything, and I'm only checking this for a pulse and breathing for no more than 10 seconds. That is the maximum we're going to be checking, and in this case, I have a weak pulse of 60, and our patient is apneic. He's not breathing.
Apneic. That means not breathing.
So the next step is going to be opening the airway for our patient. So what we're going to do is we're going to do a head tilt chin lift maneuver, just like so. So now I'm looking down the airway, and I see that the airway is clear. So that is an indication that I can use an OPA, which is one of these devices over here. And I'll show you. There's different sizes for adults, pediatrics, just different sizes of adults, different sizes of kids. And the way to measure for the correct size is like this. You're gonna check from the corner of the mouth to the tip of the earlobe, just like so. So right there, that's about perfect for this patient here. Now what we're gonna do is we're gonna insert it until we get to the soft palate, which you can feel in the patient's mouth. And once you get to that point, you're gonna flip it 180 degrees and drop it in, just like that. And the only time we're not gonna use this is if the patient has an intact gag reflex. So if the patient has a gag reflex and starts to choke on it, we're gonna remove it and use an NPA.
Here's what an NPA looks like. And here is how an NPA should be used. Look at that.
Okay, so our patient has accepted our airway adjunct. Our patient has no intact gag reflex. So now I'm gonna go ahead and start ventilating. I'm gonna use that CE grip that I had demonstrated earlier. We're gonna make sure we have a good tight mask seal so no air escapes. There's the C, and I have the E right on the jaw to make sure I keep that airway open. And we're gonna ventilate this patient at a rate of 1 breath every 3 to 5 seconds, because he is a pediatric, and their breathing rate is anywhere between 20 to 30 breaths a minute. I will now demonstrate. 2, 3. And as you can see, we're looking for that chest rise and fall. 2, 3, 4. Okay, so now I'm going to demonstrate this with oxygen on the bag valve mask. So I have ventilated our patient for 30 seconds without any oxygen. Now I'm going to go ahead and check for a pulse, look for that breathing again. For no more than 10 seconds, we still have that weak pulse, and we still are apneic. So now I'm going to connect this bag valve mask to oxygen. And how we're going to do that is plug in this end of tubing to our cylinder here.
Regulator.
If you'll notice, our rate is at 15 milliliters per minute. I'm going to plug this in here. This bag is going to fill up with oxygen, and we're just going to continue at that rate of 3 to 5 seconds every breath. 1, 2, 3, 4. Look for that chest rise and fall. 1, 2, 3, 4.
And now here's a set of fins to signify that the film is over, like as in finished. Thank you for watching. I hope you enjoyed this film and learned something today.